Hello everyone, I am Dr. Shivani Sachdeva Gour, Director of SCI IVF New Delhi and Noida. Today I will be speaking to you about COVID-19 infection and IVF treatment. As we are all living in a COVID pandemic and it looks like this is going to continue for some time to come. So fertility societies all over the world have said that we cannot delay IVF treatment because delaying treatment can have a negative effect on your success rates. At the same time, the goal is to maximize our patients' safety and security. Keeping all these points in mind, I would like to give you some information about IVF treatment during this pandemic. If you had IVF treatment and you were diagnosed with COVID-19 infection during your treatment, it is very likely that your treatment may have been postponed. If you had egg collection already, then it is likely that your eggs and sperm were frozen. If you had COVID-19 infection after IVF, then recent studies and meta-analysis have shown that it does not really impact or have any negative effect on your pregnancy. So it is not an indication that you should terminate your pregnancy. You should continue it with all safety precautions. Now, if your IVF treatment was postponed, when should you go ahead and start it again? The evidence that we have suggests that if you are planning a fresh IVF cycle, that means that if you are going to have the process of egg collection and sperm collection in a fresh cycle, you should wait for at least 3 months. The reason behind this is the process of spermatogenesis and follicular genesis or oogenesis in the woman takes anywhere from 60 to 70 to 75 days. And what we want is that your eggs and sperm not to be exposed to the COVID-19 virus when they were being generated, because the ACE2 receptors of the COVID virus are present throughout the reproductive tract. Not only that, they are also present in accessory glands, for example thyroid, the pituitary gland and the adrenal gland, which are very closely linked to reproduction. So it is ideal to wait for a period of 3 months before you are planning a fresh IVF cycle. On the other hand, if you have already had IVF treatment, a fresh cycle after COVID-19 infection, there is some studies which say that you may have a reduction in the number of top quality embryos or TQE. So it is mindful that you should bear this in mind, that immediately after a COVID-19 infection, within a month, you may have a reduction in your top quality embryos. If you are planning a frozen cycle, which means that your eggs and sperm are already frozen and you are just going to go through the process of embryo transfer, in that case, you do not need to wait for this mandatory period of 3 months. You can plan your treatment after your complete recovery from your infection. Always remember that you must consult your fertility specialist because the particulars in each case can vary. And all this just goes to reinforce strongly that we must follow all our social distancing protocols, avoid large crowds, must always wear our mask, practice hand hygiene and practice hand washing regularly. Thank you.